So this video is about the 3 most effective things to do for your neck and headaches.
We are Witty, Pask and Buckingham, chartered physiotherapists in Northampton. We have been the leading physiotherapy clinic in the region for 40 years. We treat bone, joint, muscle, tendon, ligament and nerve issues all over the body. Using manual and manipulative treatment techniques, shockwave and exercise regimes, we work to get you back to full health as quickly as possible.
Constant and unrelenting headaches, potentially with light sensitivity, can be very serious, and if you're getting any of these, then you need to get to see your GP or your physio as soon as possible. However, there are a lot of headaches that can be caused by poor sleeping postures. Is the most common. You sort of wake up with a crooked neck, you wake up with a headache in there. It can also come from postures, slumping in front of desks and computers all day. And these type of headaches, these ones that are on the back of the head, can be on the top of the head and sometimes down over to the eyes, and certainly felt in that very much that base of the skull area. These are the ones that these next exercises can be very helpful in dealing with. So most of the tension that we get with headaches comes from this base part of the skull. So you feel the lump on the back of the head, follow it down, and you get into this hollow spot at the base part of the skull. Now that gets very tight. There are small muscles in there that, with a chin poking, protracted sort of chin, that all gets very gummed up, and we need to massage and stretch that lot out. The simplest way of doing that for yourself is to just tip your head over and turn it slightly round. Then take the fingertips of one hand, find that spot in the base of the skull, so go to the lumpy bit on the back, drop down into the hollow, the base part of the skull, and then just come round to the side. And there'll be that almost intuitive ouch spot, the spot that you go, yeah, that's where it is. Get your fingers, work into there, you're not going to damage anything into there. Tip your head over a bit, fiddling around with the angles to get the right bit of tension, and then work into it in a nice, even, gentle manner. Just for 30 seconds, minute, until you feel that starting to release off. Then take it a little bit further, change the angle again. So this is a stretch, a side stretch for these muscles in here. Once you've massaged and mobilised them out, to get the stretch into that tissue. Ways to start is good upright posture in the chair, looking straight forward, not pointing the chin out at all. Place your hand on the opposite side to the one you want to stretch on the top of your head. And the hand on that side that you are going to stretch, grip hold of the side of the chair and just get it so you're just dropping that shoulder down. You then take your head over to the point where you start to feel the stretch in that same area you've just been massaging, and again fiddle with the angle until you get that spot and you'll go, yeah, there we go. And you just hold that position, keeping the shoulder down and just taking the head into that stretch, 30, 40 seconds. And then rest and repeat. If you get burning, if you get pins and needles, you get stuff going down into the arm, ease back a bit. We don't want to overstretch into those nerves. So it's just into the tension in this part of the neck and then down and over here. Retractions are simple exercises which work on those muscles at the front of the neck that, when they're weak, allow the neck and the chin to poke out and forwards. And we're working on getting the strength so they're able to hold your neck up in a much better posture, much like your tummy muscles and your low back. The way to work these are sitting straight, upright, and it's a slow and controlled movement where you're drawing your chin inwards towards the neck. Trying to make double chins. You'll feel a cramp-like feeling deep into the neck in the front. Just ease back a bit if you feel this. It doesn't need to be that hard, it's just that low-grade tensioning that we're looking for into there. You will get this crampy feeling though, and that is often because these muscles are very weak, and it's just these muscles really not being used to working very much. Hold in for about 5 seconds, repeat about 10 times, several times a day. The keys though are to make sure that you're not dipping your chin down as you're doing it, or equally poking your chin up. It's keeping your head level and sliding back from there to the point where you feel a bit of work, a bit of activity, but not pain. So if following those exercises it doesn't settle within a couple of weeks or so, then we need to look at the reasons behind that. Now that can be to do with stiffness, stubborn, locked up joints in the base of the neck, particularly if it's been there for a long time. It can equally be to do with really thick, fibrously soft tissue in that base part of the neck where you've been poking the chin for a long time in poor postures. Sometimes that can then need a bit of manual therapy, a bit of mobilisation, sometimes manipulation of those joints and the nerves and the soft tissue all together to get everything freed up in there to then help you make those exercises and other ones that your physiotherapist can offer much more effective. Sometimes also we need to talk about posture, work postures, but it can also be to do with more global things to do with stiffness in your upper back, lower back and throughout the whole body. So these recurrent problems sometimes need a lot more of a holistic approach to it as well.